Hi, I'm Annabelle Watson. I'm from Eventum Orthopaedics. We were founded in 2020 when my colleague John Naver, the CEO, had an idea about how to revolutionise treatment of the patellofemoral joint in knee surgery. So for context, 2 million total knee procedures are performed globally each year. That was in 2020, and in 2030, we expect that's going to rise to 3.5 million procedures. Now, in the UK, there are 100,000 procedures completed every year, and the National Joint Registry has published that only 80% of those patients are satisfied with their outcome after knee surgery. Now, 8% of patients have anterior knee pain following knee surgery, which is lasting and can seriously affect their quality of life. So what is the current state of the art? So there has been a lot of innovation in knee replacement surgery, particularly with the femur and the tibia. We now have robotics where we can perform very accurate resections to these bones, and also implant design has had a lot of money invested in it, but there is no attention being paid to the patellofemoral joint. At the moment, surgeons often perform a standard patellar resection for all of their patients. This can be done either with a jig or freehand, which is definitely not as accurate as they are with the femoral component. This diagram here just shows the variability in planning of the patellar resection and also the inaccuracy of the patellar resection that they have actually completed. So, what is QuadSense? QuadSense is a sensor, and it is used during knee surgery to provide surgeons with real-time intraoperative information about the force through the patellofemoral joint. We start off with a conservative resection of the patella, which allows them to put the sensor in, and then we collect a measurement of the force through the patellofemoral joint. Surgeon can then complete their surgery as normal and then take a comparative measurement with the trial implants in. This gives the surgeon information about how what they've done to the femoral component and the tibia has affected the position of the patella and the force through the patellofemoral joint. They can then use different spacer blocks to adjust the position of the patella to correct the load going through the patellofemoral joint. So here is a sample of readings from a surgery, one of the first surgeries that a surgeon did in the UK using our technology, with a sensor reading against the natural knee on the left and in the middle on the resurfaced knee. And we can see the red line there is the lateral load through the patella, and that has increased by about 100%. This is information the surgeon would not have if they hadn't used the sensor. What they did to address that was to remove a bit more bone on the lateral side of the patella to drop that load right down. This is also a sample of surgeries done by a surgeon in New Zealand. He was the first surgeon to use the product, and this is the percentage change of lateral load and superior load across those 9 patients from at the start of surgery to at the end of surgery. Now, it's not uniform. It's not the same result every time, even though this is the same surgeon across a few different days with the same instruments, the same robot. It's very controlled, but sometimes the load is increasing by 50%, sometimes by 100%, and sometimes it's even decreasing. The surgeon can then use this information to address how they manage the patellofemoral joint. So why do we want to assess the load through the patellofemoral joint? Well, we know that an increase in 2 millimeters in the patella can cause a significant increase in load in pressure, and that increase in pressure can cause anterior knee pain. Currently costs the NHS £5,000 a year to treat each dissatisfied patient. So using this technology will give the surgeons more information about how they manage the patella with the aim to reduce the number of dissatisfied patients. This can then generate more time for them to treat new patients. Thank you.